Vitamin B12, a water-soluble vitamin. The recommended daily allowances for vitamin B12, 0 to 6 months, 0.4 micrograms, 7 to 12 months, 0.5 micrograms, 1 to 3 years, 0.9 micrograms, 4 to 8 years, 1.2 micrograms, 9 to 13 years, 1.8 micrograms, 14 plus years, 2.4 micrograms, and during pregnancy increased to 2.6 micrograms and increasing to 2.8 micrograms during lactation. Vitamin B12 exists in several forms and contains the mineral cobalt, so compounds with vitamin B12 activity are collectively called cobalamines. Methylcobalamin and 5-deoxyadenosylicobalamin are the forms of vitamin B12 that are active in human metabolism. Vitamin B12 is important for metabolism, the formation of red blood cells, and the maintenance of the central nervous system, which includes the brain and spinal cord. Vitamin B12 is required for proper red blood cell formation, neurological function, and DNA synthesis. Vitamin B12 in food is bound to protein. As it reaches the stomach, the acid and pepsin help release vitamin B12 from food proteins. Cells in the stomach lining release intrinsic factor. In the upper portion of the small intestine, the duodenum, the intrinsic factor binds to vitamin B12. In the lower part of the small intestine, the ileum, the vitamin B12 intrinsic factor complex binds to receptors on cells, allowing absorption. A small amount of B12 not bound to intrinsic factor can be absorbed through passive diffusion. In the colon, B12 is synthesized by microorganisms but cannot be absorbed. Naturally present in some foods, it's added to others and available as a dietary supplement and a prescription medication. Natural sources of B12 are eggs, meat, poultry, shellfish, milk, and milk products. B12 can also be added to fortified grain products such as cereals. B12 is in the form of cyanocobalamin and occasionally hydroxycobalamin, can be administered parenterally as a prescription medication, usually by intramuscular injection. Some of the deficiency symptoms are megaloblastic anemia, which is a condition in which the bone marrow produces unusually large, structurally abnormal, immature red blood cells. Fatigue, weakness, constipation, loss of appetite, and weight loss are other major symptoms. Neurological changes can include numbness and tingling in both the hands and the feet. Neurological symptoms of vitamin B12 deficiency can occur without anemia, so early diagnosis and intervention is important to avoid irreversible damage. Some additional symptoms include difficulty maintaining balance, depression, confusion, dementia, poor memory, soreness of the mouth or tongue. During infancy, signs of B12 deficiency include failure to thrive, movement disorders, developmental delays, and megaloblastic anemia. The Institute of Medicine did not establish any upper limits for B12 because of its low potential for toxicity. In dietary reference intakes, thiamine, riboflavin, niacin, vitamin B6, folate, vitamin B12, pantothenic acid, biotin, and choline. The Institute of Medicine states that no adverse effects have been associated with excess B12 intake from food and supplements in healthy individuals. Even though there's no toxicity levels, they can interact with other medications to cause adverse effects. Vitamin B12 has the potential to interact with certain medications. In addition, several types of medications might adversely affect vitamin B levels. A few examples are provided below. Individuals taking these other medications on a regular basis should discuss their vitamin B12 status with their healthcare providers. Chloramphenicol, protein pump inhibitors like Prilosec and Prevacid, H2 receptor antagonists like Tagamet, Pepcid, and Zantac, and metformin, an anti-diabetic medication. Most interesting to me about vitamin B12 is the largest and most structurally complicated vitamin. Neither fungi, plants, nor animals are capable of producing vitamin B12. Only bacteria have the enzymes required for its synthesis. Many foods are a natural source of B12 because of bacterial symbiosis. Thus, B12 can be produced industrially only through bacterial fermentation synthesis. A recent online article from ScienceDaily.com on October 18, 2016, titled "Folinic Acid Could Help Children with Autism Communicate Better." Even though folinic acid is not a vitamin B12, it is a B vitamin from a B vitamin. In a study mentioned in the article, said improvement in verbal communication was significantly greater in participants receiving folinic acid as compared with those receiving the placebo. The findings should be considered preliminary until the treatment has been assessed further in larger, long-term studies. The researchers indicated they are very pleased with the positive findings of this study, but cautioned that more long-term studies are needed. Vitamin B12 is an essential micronutrient that we need to maintain optimal health. Although there are no data to indicate vitamin toxicity, there is plenty to show problems with deficiency. If we are not consuming enough of the foods that provide B12, then we need to take additional supplemental B12 to ensure we have enough. There is also ongoing studies to other health benefits of taking vitamin B12.